Hello, everyone, and welcome to another incredible edition of Ask Dr. Danzinger with Dr. Michael Danzinger, world renowned diabetes reversal expert. Today, we have received so many questions for Dr. Danzinger over the past week or so since our last session that we decided, you know what, we're just going to make this a free for all and try to get to as many questions as we can, which range anywhere from intermittent fasting to the use of keto in reversing diabetes to people asking about their kidneys and oh my goodness, all of the above. So if you have a question for Dr. Michael Danzinger, go ahead and put them in the comments section and we're going to try to get to as many questions as we can. And if we need to roll over into next week's session as well, we will do so. But Dr. Michael Danzinger, thank you so much for joining us. Dr. Michael Danzinger actually practices if you have Medicare or Medicare Advantage PPO plans in Minnesota, Virginia, New Hampshire, Massachusetts, or Florida. You can definitely work virtually with Dr. Danzinger. He's worked with several patients of ours with the Global PAD Association and has truly helped in a very short time reduce their A1Cs, which improve their prognosis if they have coronary artery disease or peripheral artery disease as well. But thank you again, Dr. Michael Danziger. Appreciate you joining us and um, entertaining a free for all. Whatever questions come, will come.
Thank you, Kim. I'm excited. All right, bring on the first question.
Okay, we have one from Judy, and she is asking about the keto diet. Do you use keto diet for reversing diabetes? And what happens to the cholesterol levels if you're on a keto diet? Yes, great. It's going to help with the A1C, maybe, but is it going to have the opposite effect on your cholesterol levels?
Okay, that's a great question. So first of all, what do we even mean by diabetes reversal? Because there's no cure for type 2 diabetes. We're talking about type 2 diabetes and trying to get it into remission or as close to remission as possible. And I want to see that A1, I want to see the blood sugar normal or nearly normal on no medication. So that's what we're talking about. And we use diet and exercise and lifestyle to do that. So there are many good eating strategies out there. Let's say that there's like 10 different eating strategies and then different variations of each of those. And they go across an extreme. And the keto diet, which is almost no carbohydrate, is on one extreme. And yes, I use the keto diet just like I use all the different eating strategies out there. And each eating strategy has strengths and limitations and drawbacks. And so for what I there's some things I like about keto and there's some things I don't like about that. And I would say that's the case for all eating strategies. So keto, and we're talking about keeping the carbohydrates less than, 30 grams a day, let's say. So it's meats and cheese and eggs and very few vegetables, just non-starchy vegetables, probably no fruit or almost no fruit. And so it's meat, cheese, and eggs mainly. And what I like about it is the carbohydrate is so low that it allows you need very little insulin in order to manage the blood sugar. So it's the most favorable, I think, for lowering the blood sugar. And it allows the beta cells of the pancreas, which make insulin, it allows those cells to rest. That's what I like about keto. What I don't like about it, it's especially good for people who like meat, cheese, and eggs. But what I don't like about it is people have a hard time sticking to it long term. Maybe they get tired of meat, cheese, and eggs, or maybe some people don't want something that's so extreme. And then it's high in fat. And so some people don't worry about the type of fat and other people do. And so what I don't like about the keto diet is it does have a lot of animal fat from meat and dairy. And if you're losing weight, then that usually offsets the rise in cholesterol that you might expect from eating animal fat. But if you're not losing weight from it, or if you happen to be an overabsorber of cholesterol, then you might see elevations of that bad LDL cholesterol, which stiffens arteries and clogs arteries. So it's the least good for lowering cholesterol, but it's good for raising the good cholesterol is good for lowering the triglycerides. And so I use it not as a first choice, but often as a second or third choice for diabetes reversal. Great question.
So that answers Judy's question. I think it answers Jean's question because can you use the keto diet to reverse diabetes or put it into remission? And your answer is yes. But then following up, we have Ross who wants to know, is it really good though, or is it the only way that keto works is to focus on the animal fat? Do you need to focus on animal fat in order to follow a keto diet? Or is there another way to follow a keto diet and not focus on the animal fat, which could ultimately raise the cholesterol?
A great question. So I use many other eating strategies besides keto to reverse diabetes. But when using keto, there's a trade-off. So when in principle, you don't want all that animal fat. You want a lean version of the keto. So if you could just do lean proteins, egg whites, and not include the yolks, or chicken breast rather than including dark meat, or very lean red meat. And when you eat red meat, you want, pasture raised. And when, so in principle, you can do a fairly low fat version of keto, and then it would just be very high in protein because you're not eating carbs and you're not eating fat, so that leaves protein, and you can do it. But in practice, it's very hard for people to stick to keto if they're really restricting the options to just those few sorts. So in practice, it's pretty hard. But if you just mainly focus on fish and poultry breast and lean red meat and egg whites and salad vegetables, you can have the best of all worlds. And some of my patients do it that way.
Okay, so you've been hinting at there's something else beside keto that might work. And that's where Lashana comes in. She wants to know how to reverse type 2 diabetes. She has also peripheral artery disease. It's something aside from the keto diet. What would be your choice for most that seems to be the most sustainable for people?
Okay, great question. So let me list a few examples of any eating strategy that almost any eating strategy has the potential to reverse diabetes through weight loss. And so the best way to reverse the diabetes is losing weight, cutting your calories through a good eating strategy. And I so you can even use a low fat, high carbohydrate eating strategy that's vegetarian and whole grains, like the Ornish or Esselstyn diet for reversing diabetes, as long as you're losing weight. Then, if you lose enough weight and get to your remission weight, yes, absolutely. But I don't really love all those whole grains and I don't love all that carbohydrate. I like a wide range of vegetables, a wide range of fruits, and a wide range of lean proteins. And so I would call it a moderate carb eating strategy. We're talking about 100 grams a day of carb, or somewhere between 80 and 120, let's say, which is half as much carb as most eating strategies. So a moderate carb eating strategy focusing on lean proteins, a whole range of vegetables, a modest amount of fruit, maybe one or two pieces of fruit a day. That's the kind of eating strategy I favor because I think it's more sustainable. It doesn't have so many of the drawbacks that you see in keto, but it's also limiting. And people might want to be able to eat whole grains, and it really doesn't embrace that until you're in maintenance. Great
Which
question.
is tough. I mean, if you have the MTHFR mutation, which makes it difficult to turn food into fuel, then the whole grains are really tough. And that could be something that Callie is dealing with because she said she read the Dean Ornish and Estelin books, and they focus a lot on the whole grains. She said she tried focusing on eating whole grain, whole wheat spaghetti, whole wheat breads, along with all the vegetables, beans, and nuts as well. And she said her blood sugar still went through the roof, and she doesn't understand. She says she would have thought that heart disease reversal diets, such as those, would include one of the biggest risk factors, which is diabetes. And nope, she says not for her. She just doesn't understand that if we supposedly need these whole grains, is she in trouble because they actually seem to spike her blood sugar so she can't seem to eat them?
Great point. So I will repeat what I said is I use all different eating strategies. They all have pluses and minuses, and I'm not going to say anything. Um, I'm not going to say that one eating strategy is better than another. They all are important. They all have value. And the reason I say this is because 20 years ago, I was able to do research comparing popular diets for diabetes reversal. And I compared the Atkins, the Zone, which is a moderate carb, the Weight Watchers, and the Ornish, very low fat vegetarian diets in a head to head trial over the course of a year. It's a randomized study. It was published in the Journal of the American Medical Association in 2005. And so 20 years ago, and it was a four-way tie. I was expecting the low-carb diets, like the Atkins and the Zone, to be the winners. I thought they would reverse diabetes better than the Weight Watchers or the Ornish low-fat diets, but it was a four-way tie. They all reduced weight and to a similar extent, and the more weight people lost, the more it reduced their insulin and improved their lipids and blood sugar. And so but not all diets work for all people, and you have to do some matchmaking. And so, for certain people, that Ornish or Esselstyn type diet's a terrible fit, but for other people, it's a very good fit. And as long as you're losing weight, you're lowering your insulin, you're lowering your blood sugar, and you're going to reduce your risk of heart disease, etc. Having said that, though, for some people, you just have to find the right eating strategy. And for you, dear listener, the all that whole grain, spikes the blood sugar and it's not a good fit.
Okay, so I love this coming question. Lisa asks about the supplements and vitamins to control glucose the best. Which ones may help with the reversal of type 2 diabetes? Now, before you answer, I was reading a study, and it's actually in our book, Food for Thought, which people can find on Amazon. You can look up peripheral artery disease, and the book shows up. But in that book, we talk about a study on cinnamon, Ceylon cinnamon capsules. And 2 or 3 weeks on, 2 weeks off, they say that they have found that it lowers the A1C. I'm not sure if you have any thoughts on Ceylon cinnamon or any other supplements that you work with for your patients.
Great question, great point, Kim. You make a very good point about the cinnamon. So here's my thinking on it. First, let me say food is 10 times stronger than supplements for lowering blood sugar. I'm going to say it again. Food is 10 times better for lowering blood sugar than supplements. Having said that, though, I think my number one supplement is berberine. So, berberine has some randomized trials that show you can lower the A1C up to around zero point 0.5, maybe zero point 0.3. So, let's say you can get your A1C down from 7.3 down to 7.0 with berberine. So that one probably is the most evidence. Cinnamon also. So there's a mix of studies on there. Ceylon cinnamon is the kind you want. And I'm not sure how much it lowers the A1C. Let's call it zero point 0.2. And you have to use, a generous amount and every day. But cinnamon's delicious. You put it in your food or into your beverage, and why not? So some people have found lead contamination in cheaper versions of cinnamon. This is not the Ceylon cinnamon, but the everyday cinnamon that you would get out of the baking aisle at the supermarket. And so it is possible to eat too much lead as a result of overdoing the cinnamon. And that's a shame because lead is contaminating the soil in some parts of the country where they grow cinnamon. But cinnamon can lower the A1C in some, according to some research studies. Other supplements like turmeric and Kim, help me out with a few others that might come to your mind.
You know what I really love is actually I was reading a study about chia seeds. So ground chia seeds have been clinically proven to affect blood sugar so significantly that it's contraindicated for people on insulin in large quantities.
Okay, so great point. So, and then studies of omega-3, fish oil have kind of been disappointing for lowering diabetes risk. And
You need to take so much of it, versus
uh,
having a consistent diet where you're
uh,
eating your number one choice, which would be salmon.
yes, so overall, I'm going to say that I've been terribly disappointed by the research. The I've been disappointed by the results that we see in research studies of supplements, but if you had to pick one, I would go with the berberine and just follow the instructions on the bottle.
That's it. That's fantastic. And always check with your own healthcare provider to determine if that's actually right for you, no matter what the supplements, no matter what the diet. And as I said, Dr. Danzinger, and he's actually expanding his practice to many states, and his service is virtual and it's covered by Medicare and it's covered by many Medicare Advantage PPO plans. And as I mentioned, in case you're just tuning in, he is covered in Minnesota, in Virginia, in New Hampshire, Massachusetts, and Florida. Moving on to Pat. Now, Pat has a lot of questions here, so we're going to go through them one by one. She loves that we're talking about diabetes here. She's lots of research these days that point towards intermittent fasting as to a means of improving insulin sensitivity in particular and helping to reduce blood sugars. So she wants to know, what are the benefits to extended fasting? Is extended fasting able to help atherosclerosis as well?
Okay, great question. First, let me just start by saying, what is insulin resistance? So, you don't want insulin resistance, and insulin is sort of the precursor to prediabetes and then type 2 diabetes. So, insulin resistance basically happens when you've got, fatty fat in your muscle and liver, and for many people have fat in their muscle and liver. If you have fat in your abdomen, you probably have fat in your muscles and liver, and losing weight gets some of the fat out of the muscles and the liver, and that helps reduce insulin resistance. Insulin resistance is when the muscles and liver are not as sensitive to the insulin, and you want to be sensitive to insulin because insulin helps push sugar out of the blood into the muscles and liver so that you can use it. So, in a person who has insulin resistance, which is pretty much almost everyone who has weight to lose, you want to reduce. You need an eating strategy, and is intermittent fasting an eating strategy? So intermittent fasting, there's different variations of it, but let's just say for argument's sake, it means not eating after dinner, or and probably it usually means skipping breakfast. And so if you eat at noon and then stop eating after 7 or 8 p.m., that's a very common version of intermittent fasting, or otherwise restricting the times when you eat. So you close the kitchen at certain times. So what that does is it helps people eat less food, regardless of their eating strategy. So no matter what eating strategy you're following, whether it's low carb, mid carb, high carb, or anywhere in between, you can add intermittent fasting to it and basically close the kitchen. So it doesn't help that much if you're just taking the same amount of calories and spreading it around into different times. But if it helps you reduce your calories, then it lets your pancreas rest. You don't need to make so much insulin. And yes, it can help with weight loss. And when you lose weight and when you lower your insulin needs, then it helps to slow atherosclerosis, peripheral artery disease, and can help reverse the diabetes. And so, yes, I use intermittent fasting um, in plenty of patients who are following different types of eating strategies.
Is this something that is a permanent change? Because let's say your A1C drops down to 5.2 and then you end up going, oh, well, I'm fine now. I'm going to go back to eating, regular 3 meals a day or 6 small meals a day, depending on the choice. But do you, is your A1C going to go back up? Likelihood,
So,
I can imagine, yes.
yeah, anytime you're a little less strict, then there can be backsliding. But long-term maintenance is very important, right? We don't want to just improve temporarily. We want to improve forever, which means you have to maintain. Now, sometimes it's hard to maintain the same level of strictness that got you there in the first place. So it's natural to back off a little bit. So maybe you'll be 90% strict with your eating and your lifestyle program to achieve your goal, and then maybe you'll only be 85% strict in order to maintain. And I wish you could maintain at 50% or 60% strictness. That never works though, and it's never as people need to maintain maybe at 85 or 80% of the effort that got them to their goal in the first place. And so with intermittent fasting, you might let it, you might liberalize that a little bit. And if you just go back to eating the old way, then eventually you'll undo all of your hard work.
Are there any contraindications for it? Because Sarah is wondering, her doctor said don't do it, and she just doesn't understand why.
Yeah. So for people on diabetes medications, intermittent fasting can cause low blood sugar if you're on the type of medication that causes low blood sugar. So insulin would be one example, or sulfonylureas like glyburide, etc., could cause low blood sugars. Or cause, blood sugar roller coaster effect. And so I do use intermittent fasting in people with diabetes, but for people on those who are at risk for low blood sugar, it can be counterproductive. So I don't like it for that.
Okay, so is the order in which we eat food really that important? For example, she gives the example, this is back to Pat, eating vegetables first, then protein, then fats, then carbs, and then sweets. Had to add in the sweets right there in the end.
It's a great question. So I'm gonna say the short answer is no, but let me elaborate a little bit. So, it's hard enough to follow an eating strategy that doesn't dictate the order or the time of day. To add any extra rules, make just adds more complexity and challenge. So with fruit, for example, fruit fruit has sugar in it. And I encourage fruit for my patients who are not following the keto diet, but fruit can raise the blood sugar a little bit, and it doesn't raise it as much if you have protein or fat at the same time that you have the fruit. And so it's actually a better strategy to include protein or fat when you have fruit because it causes less extreme of a blood sugar rise. So, but for the most part, what's most important is what you're eating and how much of it rather than the timing or the order.
Yeah, and she followed us up with the question about whether she should eat fruit on an empty stomach. She was hearing that some sources say that you don't reap as many benefits from fruit if you eat it on a full stomach. So she's concerned, well, how do you balance that? She does not even sure if it's true or fallacy, but what are your thoughts? I mean, it sounds like I was always taught always have a piece of protein, whether it's nuts, whether it's an egg, before I have an apple, before I have an orange to help balance out the blood sugar.
So, fruit is generally good if it's part of your eating strategy, right? It can be counterproductive on a keto diet, but in general, most people with diabetes are enjoying fruit once or twice a day, and some fruits are more sugary than others. Like, high sugar fruits like grapes or pineapples or mangoes might not be as good as berries or citrus fruits, but eating fruit is good. And I don't want people to have to worry so much about, oh, I have to have protein every time I have fruit. Otherwise, they might not eat the fruit if they don't have protein handy. Go ahead and eat your fruit. You can eat it on an empty stomach. Is it better to pair it with protein? Yes, but there's no rule that says you should eat fruit on an empty stomach in order to reap all the benefits of the fruit. I think that's just exaggeration, and I don't pay any attention to that.
And Fatina, she said she eats a lot of basmati rice. Should she cut back?
Great question. So, rice is delicious. There's carbohydrate in rice. there's nothing you can do to rice to take the carbohydrate away. So you can wash it, but you're only taking away 2% of the carbohydrate when you wash the rice. Or you can use brown rice, which is more favorable than white rice. And basmati rice is a kind of white rice, and maybe it's slightly better than the regular, American white rice. But basmati rice is starchy, and starchy foods are part of some eating strategies and not others. So, basmati rice is especially important in Middle Eastern and Indian food. So, it's very common in India and in some parts of the Middle East. And so, you just want to be careful with the amounts. Some eating strategies would not use rice at all. So, a very low carb or a moderate carb eating strategy would use minimal rice, but a higher carb, low fat eating strategy would embrace rice. So I have mixed feelings about it. Just watch the quantity of the basmati.
And in previous episodes, Dr. Danzinger has talked about wild rice as being an option, still in moderation, but you might want to also try riced cauliflower, riced broccoli. And my favorite is from Jolly Green Giant. They have an incredible, rice that is mixed with mushrooms and it's mixed with, it's the cauliflower rice mixed with asparagus and mushrooms, and it's like a risotto. And it's absolutely delicious once you stick it in the frying pan in the saucer and, you know, get it all cooked up. It's tough to tell sometimes whether or not you're eating regular rice or riced vegetables. So definitely a good option for you. And I just want to address John. You had asked about the Estolin diet. We did address that a little earlier on, so make sure you do watch the replay. His overall feeling is different strategies are beneficial to different people, and see what works ultimately for you. But he addresses the Estolin diet a little bit early on in this, and you can hear of it the full in the replay. But thank you so much, Dr. Danzinger, for being here. I'm sure we're going to get a lot more questions. We might want to do this one more time next week and then maybe try to do a general session such as this, maybe once a month, because we're getting so many different questions. And I think we were able to cover a lot. And I'm getting a lot of responses already on social media saying great information and thank you. And so I think that this is really helpful to address a wider variety of questions.
Thanks, Kim, for the opportunity. Thank you for hosting and creating the opportunity for this dialogue. Thanks, everyone.